Hi everybody, welcome to my channel. I'm Stacy, I'm a registered nurse. If you're new here, welcome in. If you're coming back, I'm so glad to have you. Let's talk about giving medications. In general, let's talk about giving medications. I think this is an area that you can utilize in home care or in facilities. We'll talk about medication administration. And if you like what you see here, then I ask that you like, subscribe, and follow for more. So let's talk about medication administration. When you learned to give medications in nursing school, when I started, it was the 5 rights. So now there's 6 rights. You know, right time, right place, right person, right dose, right medication, right? And I can't ever remember the 6th, but I think it's something that, documentation, it's the documentation, y'all. I'm getting older. Sometimes it leaves my brain for a minute. So when you're giving medication, you want to be sure that you're looking at what you're giving in the medication administration record. You want to make sure that you know what it is. You want to make sure that it is the correct dosage. And you want to compare that, whether you're in a home setting or whether you are in a facility. You want to be looking at the label on the medication. You want to make sure that it's not expired. You want to make sure that the name and the dosage are correct and that the amount, the frequency is correct. You want to make sure that it has what route you're giving it. I feel like I probably said the 5 rights wrong because I'm getting old. Right dose, right route, right time, right patient, right medication, and right documentation. So you want to look at the medication name. You want to give the right medication. Does it match what's in the medication administration record? Does the strength match what the strength says in the administration record? Sometimes a pharmacy will send a 5 milligram pill and change it to 2 5 milligram tabs to equal 10 milligrams. So you need to make sure that your MAR and that your medication match so that there's no confusion for anybody involved in giving that medication. It needs to be very clear what route you're using. Are you giving it by mouth? Are you giving it under the tongue? If it's a shot, are you giving it intramuscular? Are you giving it subcutaneously? Are you giving it intravenous? You need to know what you're doing with the medication that you're doing, and you need to make sure that it matches in the medication administration record and on the medication itself. There should be a person's name, an expiration date, and you should look at the expiration date of your medication because sometimes, for example, PRN medications, maybe someone hasn't taken Tylenol in 2 or 3 months, and this is an expired medication. We need to be looking at our expiration dates when we're giving medication every time. We need to look at the medication every time. If it's a person that you're giving medications to every day, you need to still compare the doses every time. Because what happens is when we leave and we go home at the end of our shift, orders change, right? Orders change. So you need to make sure that nothing changed while you were gone because what's in the MAR may not be what's on the card. Maybe someone got a new order from the doctor and the order went from the doctor's office to the pharmacy and now it is on a pill bottle, but it is not matching what is in your patient's medication administration record. So you need to reconcile your medications and you need to be sure that you are giving the right medications to the right person. That is really critical. And this is how errors get made is if we go along in our day. For example, in facilities, you get into a habit, right? If you work in a long-term care facility and you take care of the same people every day, this is your hall, this is your unit, you have X number of people to pass medications to. Susie takes her insulin at 7:30 before she goes down to the dining room to eat breakfast after you check her blood sugar. And, you know, Mary down here, you need to go check her blood pressure and give her medication for her blood pressure. But maybe the doctor discontinued the blood pressure medication. So in a facility, it's really important that you give a good report and that you take a good report. It is not acceptable. I know you want to get your day started. I know you want to go home. It is not acceptable for you to come in or try to leave without first giving a good report. Whoever's coming on needs to know if something critical happened. I'm not talking about a rundown of every minor detail that happened, but we need to know and share what is critical that happened in our shift. It's really important. I don't know how it is in facilities, but it's always been that we had a 24-hour report log where we wrote down anything critical like antibiotics that need to be documented on, fall documentation, new medication documentation, flu shots that have been given. There's documentation that you should be doing every shift, right? And that should be communicated somewhere so that everybody is on the same page. I know we're talking about medications, but I'm going to back up and just ease this in, and we can talk about this on another video, but it's really important to do walking rounds with the person that's coming, and we'll just leave that at that. But it is also important to count your narcotics. Don't ever, 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 ever accept keys from somebody without counting what is in that box and making sure that those numbers match. Because you should never, ever, ever put your signature on a line that you didn't do, because it will come back to bite you. If you didn't do it and you say you did, you become accountable for it if it's wrong. So never let somebody walk out of a door without counting narcotics with you. And never walk out of a door without counting narcotics. If you have to get out of the door urgently, you still have to count your narcotics. You can't just throw the keys down. If that's the only thing you did, you need to count those narcotics before you run out urgently. You need to say, hey, Mary, I gotta go. I have an emergency. Please come count the cart with me. Because Mary should not take your keys or take responsibility for your keys without knowing that that is correct and that you sign those things off. I'm sorry, but you're a nurse and you have to take accountability for counting narcotics. In a medication administration point of view, if you give a narcotic, you need to sign it out in the PRN record, right? If you give a scheduled narcotic, opiate, whatever, you need to sign it out in the MAR and sign it out in the book. And I'm talking from a facility standpoint. When you're giving medications, you are signing out the medications that you have given. You're doing your 3 checks, your 5 writes, your 6 writes. Your 6th write is documentation. Don't document before you've done something. Don't say that you gave a med that you didn't give. If you get distracted and you walked away from meds and you signed that you gave them, you may not remember to go back and give them. So if they did not go into somebody's mouth and they did not swallow them, don't sign them off on the MAR. If you are giving medications and you have a medication administration record, you need to do your checks, put your pills in the cup, take your pills, make sure it's the right person, verify that it's the right person, and you need to know what's in the cup that you're giving. You need to know what's in the cup you're giving, because Mary is going to ask you what this pink pill is for and why she has to take it. And you need to know, well, Miss Mary, that is your lisinopril and that helps control your blood pressure. So you need to know what you're giving, why you're giving it, and you need to make sure that you're documenting that you gave it. And don't document it if you didn't do it. The other thing is, if you did do it, please be making sure that you're documenting it, because it is so critical that you do that. And it is so important, if you give a medication that's a narcotic, that you sign it out in the MAR and on the narcotic log, because that is going to become a legal issue and can hurt your career if you don't. And it's never happened to me, thankfully. I would knock on some wood somewhere, but it's really important that you pay attention to narcotic counts. It's really important that you sign those things. And then if you give a PRN medication, it's really important that you go back and verify if that medication was effective. So when we're giving PRN medications, I know we have electronic records now. It should flag it to yellow or something like that in some systems, to where you need to go back and document, is this medication effective? And really, you should be going back in about 30 minutes and seeing if that medication had any effect on that patient. Did it bring their pain level down? Did it control their anxiety? We have to document why we gave something. They had anxiety. We tried A, B, and C first. That did not work, so we gave this medication. We gave this medication and it brought our anxiety level back down. It's important that you document why you did it, what you tried before, and if it was effective. It's a pain in the butt. It's a lot of steps, but you need to do it. So when we're talking about medication administration, it's important that you document what you did, document the effect of what you did, and sign out your narcotics and count your cart. You always want to count your cart, and don't accept medications. Don't accept medications. I mean, when the pharmacy comes, you have to sign for the medications, but don't sign for the medications if you didn't review that that medication was in the box. Because that's happened too. The pharmacy will say they sent a cart of medications and they did not. So it's always good to have two people. When you're checking in medications from a pharmacy, it's important to have two nurses. It is hard to stop what you're doing in the middle of your day. But I'm telling you that if you safeguard yourself and you protect yourself as a nurse, you're not going to get into trouble and you're not going to make mistakes. It's really important that you don't make mistakes. You have to be excellent when you're a nurse. That's not to say you're never going to make a mistake, but you need to strive to be excellent and not make mistakes because you're taking care of people and you're dealing with their lives. So it is really, really critical that you have accountability. And I always took another person with me if I signed in medications because you need two people as a witness for narcotics. You know, when you count the narcs in a cart, you have to have your signature, the person that's going off, the person that's coming on. Something that we had to do in other facilities where I work too with fentanyl patches is that when we did a walking report at the beginning of the shift, we would look and see, is the fentanyl patch where the chart says it is? And you had to make sure there was no other fentanyl patches on the person as well. It's a lot. But because people have done things that are shady and made mistakes by not doing what we're supposed to do, we now have to double check and triple check and quadruple check ourselves and protect ourselves. You have to CYA. You have to cover your butts all the time in nursing. You have to, because I'm going to tell you that even though you like working for your employer and even though your employer is kind to you, if you make a mistake, they are not going to support that mistake. So understand that you need to cover your own behind and make sure you're doing things correctly. You need to do it the right way the first time. It's just that simple in medication. Am I perfect? No. Have I ever made a mistake? Absolutely, for sure. I have made mistakes in my career. I will be honest with you and tell you that that is not something that I've done frequently, because it makes me sick to my stomach if I know I've made a mistake. And when you're a nurse and you're doing things, you know when you've made a mistake. The other thing that I would say about medications is when we give insulins, we need to be checking blood sugars before we administer those insulins. We need to make sure that we know where our patient's blood sugar is living at before we stick somebody with insulin. Never, ever, ever just give a short-acting insulin without checking the blood sugar. Sometimes orders get missed. Sometimes people make mistakes. It's a user error. Sometimes a doctor will give a new order for insulin and the person will DC the old orders and not put in the new order completely. There's a sliding scale you need to follow. There's parameters on blood sugars generally in a facility. And even with Lantus, there should be parameters in place that we're monitoring, and we know when to not give those medications. For blood pressure medications, you want to be monitoring someone's blood pressure before you go and give that medication. It's really important when you're on a cart. I like to do my own vitals. I do. I used to, when I was a younger nurse, really like that my CNAs did my vitals. I would give them the list at the beginning of shift. I would want it back, but I started learning that I was going to have to do it anyway. And you need to assess your patients. You're going in and out of their room. You may as well grab their blood pressure and their pulse and do their assessment while you're in there. You can kill a lot of birds with one stone. When you're in the room, you can do a lot of things when you're a nurse. So take your vital sign equipment with you and take those blood pressures before you give blood pressure medication and know the parameters. And if you feel like someone's blood pressure is too low, or there's a crazy number that you know is not within normal range, we're trained as nurses to know what a normal blood pressure or blood sugar should look like. If there's not a parameter, if there is not something that tells you to not give that medication, then you need to be calling the doctor and saying, hey doctor, so-and-so's blood pressure is such and such. Do you want me to give this medication? There's nothing to say to hold it. And sometimes, for example, if they're on a beta blocker, they have a little bit of a lower threshold for holding that medication for blood pressure that's maybe lower. because they're doing it for a high pulse. So maybe the pulse is 100 and the blood pressure is right on the threshold of what you would consider low. And the doctor will tell you, yeah, go ahead and give that. I don't want you to hold that. It's for the AFib. So always call. Don't be afraid of doctors. Don't be afraid to call them. They want you to give their patient good care. Sometimes doctors are short with you because they're busy, but we've all been busy. We've all had mood swings. We've all done things and been short with people. Don't take it personal. If a doctor is short with you, don't take it personal. Unless it's consistent. Some doctors are just cranky, okay? But sometimes you're catching them on an off day. Don't take it personal, but still call them anyway. Don't be afraid to call a doctor. Know when you should call a doctor when you're giving medications. If something seems off to you and you have a question about it, it does no harm for you to call the doctor and clarify it. And that is our responsibility as nurses. It is our responsibility as nurses when we're giving medications to know what we're giving, why we're giving it, and how it might react in our patient. That is why we went to school and learned all of the things that we did, because it is so important to be able to know when to call your doctor and what to report. How has it been in your facility or your company passing medications? Have you ever had a time whenever you didn't see a parameter or you didn't see an order to check a blood sugar, but you went ahead and obtained a blood sugar or a blood pressure anyway, and it was off, so you called the doctor and let him know? Have you ever had strange situations where something got missed and you caught it and now you had to report it? How did you handle those things? Is there anything that you would give as advice for medication administration that I didn't cover here? I would love to hear about it in my comments. And if you like what you see here, then I ask that you like, subscribe, and follow for more. And I thank you for watching, and I hope to see you soon. Bye-bye.